If you have gone through menopause or you are currently going through menopause and you are considering bioidentical hormone replacement treatment, then here are a few things to consider. So the first thing to keep in mind is that bioidentical hormones basically means hormones which are identical in their chemical formula to the hormones that exist in the body naturally. So it does not necessarily mean that these hormones are derived from human body, but it just means that they are compounded or synthesized in such a way that the chemical formula resembles that of the natural hormone. On the other hand, the synthetic hormone preparations are basically just hormones which actually are different in their structure. They just perform the same function as the natural hormones. So those are the differences. Now, if you're considering bioidentical hormone treatment, then it will basically consist of different types of estrogens and progesterone. When it comes to estrogen, then there is 3 different types of estrogen. There is estrone or estrogen 1, then estrogen 2, which is estradiol, and then estrogen 3, which is estriol. Now, when it comes to bioidentical hormone replacement treatment, we don't usually use estrone or the type 1 estrogen because that is the one that is highly correlated with or linked with the development of breast cancer, uterine cancer, and then cardiovascular problems. So we just typically just use estradiol or estriol, which are E2 and E3 formulations. We use progesterone, which is also bioidentical, and we do not use progestogens or anything that is synthetic in nature. Typically, these hormones are provided in the form of creams, but then also the pellets can be used. We do not use any oral formulations of estrogen or estradiol because estrogen tends to be highly inflammatory for the liver, and it can cause a cascade of reactions leading to clotting disorder. So you don't want to use too much estrogen that will be metabolized by the liver and cause clot formation. Instead, progesterone can be actually used orally by mouth and does not cause such problems. Now, if you're considering the bioidentical hormone replacement treatment, then a few additional things to keep in mind would be that the expectations should match what you are getting. So if you're not getting the benefit, then maybe it is time to consider a re-evaluation of the treatment or considering even stopping the treatment. So what are the possible expectations? What is it that you can expect realistically from bioidentical hormone replacement treatment? Well, there are 4 areas where this can improve your quality of life. And again, this is highly variable, and the improvement varies from person to person. But generally speaking, people can see improvement in their cognitive function with bioidentical hormone replacement treatment. People can see improvement in their sleep, especially when they're using progesterone. People can see improvement in their mood, so irritability and anxiety and depression symptoms can get better with the treatment. And then finally, people can see improvement in their energy level, especially if they're supplementing with testosterone as well. So all of these 4 areas can improve. Some people don't see much improvement. Some people just need a little bit higher dose to see an improvement. And some people just feel great, so then they can continue. Now, what are the additional long-term benefits which have been studied and published in the literature? Well, bioidentical hormone replacement treatment can improve bone health, can improve not only the density of the bone, but also the quality of bone structure, so that is a great benefit. And then of course it can provide some skin benefits as well. What are the possible side effects? So studies have shown that hormone replacement treatment can lead to development of breast cancer and uterine cancer, and then can cause cardiovascular problems. But all those studies have shown such problems when people were using synthetic hormones. So aside from that, the data does not exist in terms of any side effects occurring from or resulting from bioidentical treatment or bioidentical hormone replacement treatment. Now, what is the cost of bioidentical hormone replacement treatment? Typical cost is for the creams or gels is about $40 to $50 from compounding pharmacies. We just make sure that the pharmacy is a good grade pharmacy and they have a good reputation, so you're not getting any any impurities in your formula. And then some of the prescriptions, for example, oral progesterone, can be covered by the insurance. Now, when is it time to stop the treatment? Well, the treatment can be stopped whenever you don't see improvement in any symptoms. So after about 3 months of treatment, if you don't notice any improvement, it's probably not worth continuing the treatment. Also, if you start to see any side effects, then it may be time to discontinue the treatment. So what is the best way to monitor this treatment? We just make sure that we do lab testing every 3 to 6 months, and we make sure that the levels are steady and in a good place. Thank you so much.